30 years ago, there were advances in both basic medical science and into clinical medicine, but the meetings for bringing these two together didn't occur. There were immunology meetings in which there was little of interest to physicians seeing patients, and clinical meetings did not have much discussion of basic science that was dealing with major issues in medicine and immunology in particular. It was a rapidly growing field. There were advances in monoclonal antibodies that had been discovered 10 years earlier, and there were advances in genetics, there were advances in the molecular biology, and we could imagine applications in clinical medicine, and there was a place to come together. There were no places to come together regularly. So we established the Clinical Immunology Society to advance this field where physicians seeing patients and laboratory clinicians dealing with human disease could discuss advances as they came along. And that's what happened. And as a result of the society, there became a journal which published monthly the advances in this field. There were courses in the summer to provide education for novice and new researchers, and here for discussions of the advances that were occurring. 5 years earlier, there had been discovery of AIDS and HIV infection, but AIDS was a major and increasing disease with people dying, unknown causes, and it was a disease of the immune system, deficiency of the T cells. Hadn't been discussion about T cells much before because this was a new disease, there was a new deficiency. But that was an example of the diseases that were occurring in which clinical immunology had a major role to play in advancing understandings of the cause of disease, but also means of treating and preventing disease.